So thanks everyone who came to this talk during lunchtime. Yes, I'm Pradeep, and thanks for the nice introduction. Thanks to Republica for having me. This is my first time at Republica, so be gentle, be kind. What I want to talk about has been already introduced. I have background in cognitive psychology and systems neuroscience. I did my years in academia in very well-known institutions. I started in Max Planck, then I was in ETH Zurich, then in Cambridge, and then I returned to Germany to spend almost 15 years at Charité doing research and teaching, as well as working with clinicians. My background is in neuroscience, and it was a pleasure at Charité to be able to work with clinicians. Now, the focus of this talk is, first of all, I would like to talk how Gen X, Y, and Z sees and is there is a certain shift also in the Gen X, how this was treated back then, like mental health, thanks to Gen Z. So there is a lot of intercultural exchange or intergenerational exchange, I would say, between these generations. So I'm born in Gen Y, just about, in 1981. And the second point of this slide is, I just went too forward. Maybe I used this one. That I had a stroke just after I turned 41. And my entire right side was paralyzed. This was really unfortunate, very sad moment in my life. But it also gave me a lot of inspiration to do something about mental health. Why is this happening, and what can we do about it? And at that time I started using a lot of apps to track my physical rehabilitation, but for our mental health there was very few. It's almost like the screen. So on the physiological sides, we can track how we sleep, how much water we drink, what's our heart rate, how much calories we are burning, everything. But when we want to track something about our mental health or our thoughts, it's pretty much zero. There are some apps which are now in the meditation space, and that's already a good change. But what can we do? And that's the thing. So physical symptoms are so easy to measure, whereas cognitive symptoms are not so easy to measure. So in this talk, I'm just going to break down what we can track, which could give us a hint about how our mental health is and how we can convert this into mental well-being. And remember, I'm using two words on purpose, from mental health to mental well-being, and this would be clearer also during my talk why I'm doing that. So first, we'll focus a little bit on the mental health. That's my background. It bridges together psychology and neuroscience very well because we are looking at the brain from two different aspects. So what happens, if this would be a side view of the brain, that there is the front part of the brain, let's see if the prefrontal cortex, and this is the amygdala where a lot of our emotions are processed, and there is a connection between the front part of the brain, which helps in thinking and making decisions and not getting overwhelmed, which kind of controls how we feel and what we do. So many people call this the rational part, like up here, and this is the more instinctive part, emotional part. Now what happens in acute stress is under stressful conditions, the front part of the brain starts not operating so well, so our emotional centers are pretty much in free run. And therefore we end up in a lot of situations when we couldn't or can't regulate ourselves because it's just in free run. What this results, if it's on an acute stress level, it's okay, we can recover from that. But when this starts becoming more chronic, what this results in another loop, which we definitely want to avoid, is the brain is in free run, this affects our behavior, that behavior affects our body, and so on and so forth. So this is a loop that we would like to change, we would like to break, because the brain is not working alone, so the body is also responding to it. And this is again something I would like to challenge the decision that mind is not just residing in the brain, it's also residing in the body. There's a lot of trauma which is also saved in the body. So we have to take care of this visual cycle, that we have a healthy loop and not a bad loop. So for this, before we start, you can scan the QR code. We will do a segue to Mentimeter, and this is only for first 50 participants. So I will quickly switch to Mentimeter. And here. So yeah, people are already responding. Thank you very much. Let's see when we reach 50, otherwise we also will move on to the next question. Okay, let's say anyone else who wants to fill in this data? Okay. Next one, which generation do you belong to? Thank you, polls are coming in. Suddenly we have more than the first one, but that's great. Okay, so there is a overrepresentation of Gen Y, some Gen X, and other could be boomers or Gen Alpha. My daughter is in Gen Alpha, so that's the new generation after Gen Z. Okay, so maybe we move on to the next one. This is just a word cloud, so what's your biggest barrier to prioritizing mental health in your daily life? Just a quick word, the first word that comes to your mind. Okay. That's interesting, my brain, okay. Perfect. Stress, time, work, routine, busy, stigma, time and work, habit, I don't know how to, or task mails. Okay, so thanks a lot for your participation. And before I move on to the rest of the presentation, I would ask if everyone did put out whatever they wanted to vote for this? Okay, thank you. So we move back to the presentation. So we did see that there was a higher percentage of female participants, a higher percentage of Gen Y in this room, and time, work, busy schedules are the common hindrances to be able to take care of our mental health. But who of you have a gym membership? Yeah, and this is somehow, there is peer pressure, there is a lot of accessibility, and this is somehow we know that, yeah, when you're not feeling well, you're feeling out of shape physically, you need to do something. Yeah, so, and with the mental health, it's so much more difficult to know how I'm feeling today, and that's why it is still an elective that we can do that tomorrow, we can do it next week, because, okay, I have been kind of conditioned to go through, because I have my work, I have my family, I have my friends to see, I have my other hobbies to do. So before preparing for this talk, I also ran a survey, and that's where some of these questions also come from. That's why I wanted to present these questions. So in my survey, it was like a month ago I started this. There were like total of 74 respondents. And as you see, yeah, the same ratio of men to women. So come on, men, let's talk about mental health. I saw one talk here, at the last conference I talked about men's mental health, and this is also a big area that of focus. The next is the generation. Yeah, since I'm Gen Y, probably a lot of my friends and their friends are also in Gen Y, so I would take that with a pinch of salt. But the last data is quite interesting. It doesn't matter how dark the color is, just shows how many respondents. But it's pretty much one topic that we at the moment, agree to unite across the world on this issue, that this is really a global issue, mental health. What else? So the font is small, maybe I'll just walk you through. I asked in that survey, how comfortable are you discussing your mental health with others, family, friends, and co-workers? I didn't separate on purpose, whether it's family or friends or co-workers, and it's across generations, it's pretty good. So 5 is very likely, 1 is not likely. I think most of them are on 3, 4, 5. So I think we have reached a stage in our society, in our understanding, that we are comfortable at the moment to talk about mental health. What is the next? What is the same question that I asked before? And you see, it is quite representative of what we had in this room as well. Time, cost, not knowing where to start, lack of access, and therefore the talk here is how can we help exactly troubleshoot these points? How can we empower people at the individual level that you can take care of your mental health? And some of the surprises, which is based on this data, what is the comfort level discussing mental health in the Gen X? And it's quite high. I predicted that this would be somewhere like 1 and 2 because we always have this kind of preconceived notion that boomers and Generation X don't want to take care of their mental health because this was not a valid practice back then. No, but they're learning from us. They're learning from Gen Y, the transition generation. They're learning from Gen Z, their children, that, hey, we should talk about this. We should get into a discussion. What else? Gen Y has a lot to do. So that's why a lot of these factors are not single factors anymore. As time is still there on top, but you see from here starts like the factors to double, time and cost, because each participant could vote for more than one. So time and cost, time not sure where to start, cost, time, cost, lack of access. So in our generation of Gen Y, multiple factors play a role in this. This is much more unimodal in Gen Z as well as in Gen X, which I don't have time to show. If you're curious about the results, I can send it to you. And actually, I have for the Gen Z, you see it becomes very unimodal. So it's time, cost, but in the Gen Y, it was the most combined multiple factors which affect. Okay. And here I have some quotations to show like what, in their opinion, has your generation shaped your attitude towards mental health. So Gen X is very much on stoicism, like things have to be done, life has to go on, this is how it works, and I need to pull through. And we live in bubbles in this generation. So what some of them say is, I think we're very open towards mental health, well, at least in my bubble. So it's like your friends, if they encourage you. It was like your only, and the other one, it was like your only worth when you work hard. Mental health was not important. So you see there's a lot of ambivalence there. The last one, it's less than Y and Z, but still pretty good. So these are just some of the quotations. Next, I'll go to Gen Y. It's about transition and culture shift in this topic. I find it easier to talk to people of my age about my struggles, and I think it has become a generational thing, hopefully setting a more open attitude. This generation is really the transition generation. Gen Y was a generation that started to shift the narrative about mental health. Fighting for its importance has been a part of my journey. And like this, the last one is, again, going back towards, since it's a transition, you have both a little bit. Basically, I was raised to keep it to myself. So it shows that how intergenerational attitudes also work. If you were raised by your parents or in your bubble in a way not to talk about it, this takes longer. Okay, Gen Z, pretty crystal clear, embodiment, moving into the well-being culture. So my generation is much more aware and open to discuss mental health without too much stigma attached. I feel like my generation very much encourages discussing mental health. Open communication about it online and in person is helpful. I found it very difficult to find one negative statement taking approach towards mental health. They were like all positive. So thanks, Gen Z. You have done a wonderful job. Yeah, okay, why now, sorry. Okay. Why I want to shift from mental health to mental well-being. It's one big reason. So we have a healthy pool in our population, and we have a disease pool in our population. It's still, this pool is smaller. But in Germany, already 25% of adults have mental health issues, and this was 2024. The thing is, doesn't matter how much medication you take, how much doctors you see, this is a one-way street. You can get better, but once you move from this healthy pool to the disease pool, there is something always lingering. There is a reason why we moved to the disease pool, because our body, our mind couldn't cope with that anymore, and that's why the homeostasis shifted. So my point is, in this talk, how can we stay in this healthy pool? And there is even a word for it, and I'm going to drop that here. It's called salutogenesis. It's the ways and strategies I could stay in this healthy pool. It doesn't matter about mental health or not, but in my case, mental health to mental well-being. How can I take care of my mental hygiene before shit hits the fan? So, and who is gonna support me? So, which is my support group? Where can I find help? The talk before already kind of talked about what you can do in demence. I worked many years at Charité on this topic of demence. How can we recognize demence before symptoms appear? So this is like, how can we go 10 years, 15 years before dementia sets in? This is one way of saying, okay, we want to preserve the healthy pool. The thing is in Germany, when you come up with innovation in the healthcare sector, the first question is, who will pay? Does my Krankenkasse, does my insurance pay for this? Yes, there are more and more programs to be preventive, but still Germany is very, very interventional. So when you have something, then help is offered. But things are changing, and this is also going to change for mental health into mental well-being. So I think my next slides are going to be about mental well-being. And I asked this question also in the survey: which of the following do you currently use to support your mental well-being? Yeah, no surprise, talking with friends and family across generations. Gen X, Y, Z all said talking with friends and family. So this is how important that is. Physical exercise, meditation, mindfulness, not so much therapy counseling because of obvious bottlenecks. And the last thing I asked is, which is based on my personal interest, what kind of tools from psychology would you be interested in using? Tools from psychology and neuroscience to avoid extreme stress levels, burnout, and emotional regulation. And I think the numbers say for itself. Again, this was clear for Gen X, Gen Y, and Gen Z didn't have 1 and 2 anymore. There was only starting from 3, 4, 5. But you see also that there is a large acceptance in the Gen X, and it's not true that older people don't want to use new tools. So I'm not gonna believe in that myth, because this survey says something else. What can we do which is practice for all minds? And 3 things that you can do on a daily level, a daily basis, is mindfulness. This is talked about very much. Acceptance. You allow space for your thoughts without fighting them, and value-based living. So what are your values? Our value systems are not very clear. So I will tell you about a game where you can learn about your values, and if you have a goal to reach to, you have to know what values will get there. A goal is, I want to have good friends, but that's not a value. What are the values that I have which are going to take me there? And this is a model that I want to talk to you about from psychology. It comes from Buddhist psychology, and it's an advanced model of CBT, cognitive behavioral therapy. And everyone can do this at home. There are exercises where you can look up. It's called acceptance and commitment therapy. And all it does is, at the center, it teaches you to be psychologically flexible. Yeah, psychological inflexibility is the basis of depression. That's where you get into negative loops of thoughts called rumination. If you can develop psychological flexibility, it's a simple way of taking care of your mental well-being. What does it contain? There are like 6 important points. Acceptance and diffusion means distance to your thoughts and emotions. In the middle, it's about centering yourself, to be flexible attention to the present moment. Yeah, past, future matters, but how can I focus on what's happening now? Treat yourself as context. You're not depressed, you have depressive-like symptoms. And the last is finding your values and putting these values in your life. If you say my value is kindness, generosity, think about that, where I can bring that into action. So there are several ways of doing this, and what we do at Neuro360 is we create spaces like this at events for neuroinclusion and mindfulness. I have brought 2 of these things, so for today you can try out. I have this EEG-based meditation tool, which tracks your brain waves and also tells you how deep or not you're in meditation, and if you do it daily, you improve. First 5 minutes of meditation everyone can do, but it gets harder the longer you try to sit still with your mind. We are also developing with therapists interactive games based on acceptance and commitment therapy in virtual reality to help patients with depression, trauma, and anxiety. On the other hand, there are also analog tools. You don't have to be digital, and these are these value cards where you get like 80+ value cards, and you have to select the 5 most important values for a task. And I did this for beginning of 2025, depending what I want from this year, what are the values that is going to guide me. Okay, so the last slide would be about bridging the gap. So Gen X taught us about resilience, the emotional centers. Gen Y, we have insights from burnout, very in-depth knowledge. I would say this is the sensory areas where there is a lot of information coming in and resulting in burnout, stressful situations. And Gen Z brings in openness, the front part of the brain. So the best mental health care or mental well-being would be to develop our inner world skills through this acceptance and commitment therapy, where we can create this culture where we can learn from all generations, because mental health only then, or mental health care, is proactive and not just reactive to our generation. So the daily practice is this. It isn't a luxury anymore. It's a hygiene. Like you brush your teeth, like you move your body. Take 10 minutes every day for your mental health. No matter your age, the best day is to start today. And with this, I would like to thank my supporters, the Mind Foundation, where I work with the therapists and develop the games. Schering-Stiftung also helps support me being here. And this is my work at Neuro360, and that's me on LinkedIn.